Fairfield Community Health Center will be transforming the classrooms at South School into care rooms, providing primary and behavioral health services to anyone in need, keeping our community healthy and strong, no matter the cost. The need for behavioral and primary care for the population we serve is growing every day. Often, patients have to wait a couple of months to see their provider. Realizing this need and the current growth of Fairfield County, more space is needed to ensure the healthcare needs of our community are met. South School has been present in our community since 1931, serving generations of families, numbering into the thousands of lives that have been forever changed. Once repurposed into a health center, it will continue to serve these children and families for generations to come.
This building means a great deal to me because it was the center of my life for 5 years. It was the center of life in this whole neighborhood for a long, long time, from 1931 or 32 until it closed about 3-4 years ago. This building, South School, St. Mary's School, St. Mary's Parish, these were fixtures in the community that defined this community. And it was a great place to be, and a great place to have fun, a great place to be educated. And I'm so happy that the health center has been able to acquire this building to make sure that this building continues to serve the needs of this community and the needs of the people in this community. I have in my hand a paper. It was called The South Breeze, which was our newspaper when I was in 8th grade. And when we graduated, and there are a lot of people in here that are still around and a lot of people who have passed away, but this was a special time and a special place.
Just as the educators helped shape the lives of the children who walk through the halls of South School, so the providers and support team of Fairfield Community Health Center will continue to care for children and their families.
I'm hopeful that our new location at South School is going to be able to provide the community with some additional resources in terms of healthy lifestyles and how to live well, not just eating, but also maybe some exercise facilities and capabilities. Plus, it's going to provide our residency program with a great place to train because there will be enough space.
I think the other unique thing about our health center probably is the fact that we have the residency program. So we have family practice residents in our clinic most days of the week, and then they can follow both children and adults, and then they have staff, adult physicians to talk to about problems with their adults, and myself with the pediatric patients. One of the nice things about the practice here too, for me personally, is that I'm now seeing the second or third generation of children from the same family, and that's very rewarding.
We have a wide variety of services, and I'm very proud of what we do. We help many people. If you show up at our door, you'll never be turned away. I had a couple come up to me and needed to have a family doctor. I was able to get their information. When I went back to the office the next day, we were able to get them appointments, get their paperwork to them. They were so thankful. And I said, we take all insurances. And if you don't have insurance, that's fine too. We have a sliding scale. And so we were able to get them appointments pretty quickly, which was just absolutely amazing to them.
So Lisa, since 2009, when I think the Community Health Center got its start, there's been a lot of change and a lot of growth. So where do you think we need to go for the future?
Well, I think it's wonderful that we had the opportunity to actually purchase the South School building in 2016 towards the fall, and I think we've really picked up in 2017 how we're going to organize our campaign, our fundraising campaign, and actually provide the community with the space that they need for their medical needs. I really see the renovation of the South School as expanding our behavioral health as well as our substance treatment counseling services. Dr. Hampton, how do you envision us growing with our additional space at the South School?
Well, one is because of our affiliation with the family medicine residency at Fairfield Medical Center. We've really had the opportunity to see that grow in the few years that we've been in business. We have nurse practitioners, we have physician assistants, we have counselors, licensed counselors. We have the residents who are preparing to perhaps come into the community and work as providers in the future. And the fact of the matter is, our mission is not just about the patients who come in these within these walls, but it's also about providing the people who are ultimately going to help them. We've been very fortunate to have many students come through the Community Health Center, so we're playing a very vital role, in my opinion, in preparing us for the future to take care for the community.
Together, with your help, we can make our community a strong and healthy one as we transform classrooms into care rooms.
I'm really excited for the Fairfield Community Health Center. I think that the South School building is going to be a perfect fit for them. The wide hallways here at South and the simple floor plan layout that the original architect designed is going to be perfect for FCHC and make it very easy for patients to find their way around the facility and get to where they need to go. Now, the upstairs at South School is where the administrative offices over on South Broad are going to move in. And they'll have all their offices, large conference space, all the file storage space they need, and an additional clinic suite upstairs to house the behavioral health services that FCHC provides. Now, the existing auditorium and stage and kitchen at the rear of South School will be remodeled to become a new community space that FCHC will rent out, and along with that community space we'll have a warming kitchen and a new lobby and some new public restrooms right next to the new community space.
We're glad that you're here today. We're glad you're supporting this project, and we hope that you will take as much pleasure in this Community Health Center as I take in the building of South School.
Welcome home, FCHC.